Stress is an everyday occurrence. It is also the 6-point font hiding in the fine print of underlying contributing causes in many diagnosable diseases. How is your heart managing stress? Today's discussion is a true story by Tina Fox, a 46-year-old business owner and mother of two with no medical history or comorbidities. Her story is backed with real facts and the expert comments of her cardiologist and friend, Dr. Hamid Tahiri, who is cardiologist with Carient Cardiology, as well as the assistant professor of medicine at George Washington University. So, as someone who grew up in the 90s, I liken this to that thing we used to hear, the more you know, the commercial that would come on TV when I was growing up. This is similar to the more you know. In this case, the more you know could save yours or someone else's life. Tina Fox, tell us your story.
So less than a year ago, I was in great health. I had just lost 6 pounds, actually, and I was out for a jog with my dog, 3.5 miles. It was a beautiful Thursday. That day, I had a former business partner. We had some meetings. He took me and my family out to dinner. As soon as I finished dinner, I excused myself and went to the restroom to vomit everything I ate. It was a very unusual situation. The next day, I presented with a low-grade fever, nothing to write home about, 100.4. But like many, I postponed in seeing a doctor as I figured I had the stomach flu or something that would run its course. And besides, the weekend was coming and I had a massive yard sale that I was planning on doing. And I did not want to miss the yard sale because I was going to Marie Kondo my whole house. So as I continued with fever, nausea, and vomiting, I arose at 5 a.m. to get ready for the yard sale. But by 10:30 that morning, I could barely move. I was really short of breath. I was extremely dehydrated. I laid down for a bit, and then I proceeded to the local urgent care because it was getting very, very difficult. So they said upon testing that it was nothing unusual. There was no flu. There was no strep. They did take a blood sample, urine sample. They administered IV because I had lost so much fluid. And they provided me with an anti-nausea medication and then sent me home, but did ask me to come back in 2 days for a follow-up. So over the next 48 hours, I did what most people would do. I rested, but I became increasingly short of breath. And interestingly, I gained 12 pounds. This had never happened before. I could barely move, let alone climb a set of stairs in my house. I needed assistance with that. And I thought this was the strangest flu I had ever had. And I'm one of those Americans who, unfortunately, when the swine flu came through, I had caught the swine flu. So I knew bad flus. And this was above and beyond that. So I returned to the urgent care. And in doing so, they did more x-rays, blood work, and tests. And I ended up going home. But the next morning, I got an urgent call saying, please go to your local hospital emergency room and provide them with this information, which I did. 14 hours later in the ER and many, many tests, I became an inpatient at the hospital for several days. And it was at the 4th day that a cardiologist came in and said, you've suffered a heart attack and you need to go in for emergency cardiac catheterization. Now, I knew about this whole thing because I had spent years in the cardiac cath lab as a sales executive. And I knew for sure I did not need a cardiac cath. And so I politely asked the person to please give me some time. I'd like to call some folks that I knew for a second opinion, in which I did. And I called a physician that I've known for many, many years. And he had come out of fellowship at Northwestern 20 years earlier. And here I am calling him to see if I can't get a second opinion. And that was my entrance into what I know today.
Dr. Tahiri, I assume that call probably wasn't expected. Tell us about that call that you received from Tina.
So I remember I was in the office with a busy clinic, and in between patients, I saw my telephone caller ID, and I saw Tina Fox. And I hadn't talked to her for 2 or 3 years, and I knew that this was probably an important call, that she's calling me after this time. And when I picked up the phone and I talked to her, and she said, Hamid, I'm in the hospital and they're recommending for me to have a heart catheterization. Can you see me and can you do this procedure for me? And it was a shock to me because I remember Tina from 20 years earlier when I first started as a cardiologist in Northern Virginia. And she was a device rep for one of the famous stent companies. And remember getting introduced to her as a new cardiologist coming to the cath lab. So I've had experience working with her in the cath lab, and it was a shock to me that she is so sick that now she requires a cardiologist and specifically a cardiac catheterization. So after hearing her story, I said that I think I need to sit down and go over this with you and review your information. So I went and visited her. I can't remember, it was the same evening or the next morning in the hospital, and looked at some of the tests she had done. And sure enough, I think there was a lot of surprises there that she felt so sick that some of her test results were so abnormal that it mimics a heart attack. And even though she doesn't have any risk factors for having a heart attack, I also agreed that doing a heart catheterization is the best way to pinpoint her diagnosis.
Now, the interesting thing here is that when Tina described her symptoms, it sounded like the flu. Yet something else on the labs and the tests didn't reveal that. So what did you see that led you to believe that it wasn't just the flu?
So even though her symptoms were very similar to flu in the sense that it started with the fever, the fatigue, the myalgias, but the couple things that got my attention was the fact that she had gained weight and she was retaining fluid and she was so short of breath. But I think what really caused the change in the diagnosis was that one of her blood enzymes in the blood called troponin level was elevated. That usually suggests a damage to the heart. And anytime that we see that enzyme elevated, after a certain degree, we basically consider that this is a primary cardiology diagnosis. And I think that was the reason they were pointing toward a cardiology diagnosis and possibly a heart attack or need for a heart catheterization.
Tina, pick up the story from here. You've just been told you need a cardiac cath. So what happens next?
So because it was Dr. Taheri, I trust him, and I said, okay, let's do this. And I will say it was interesting because having been so many years in the cardiac cath lab and seeing this happen with so many people, I knew what to expect. But of course, when it becomes you, it's a different story, right? So there was trepidation because I was just nervous and I was hoping that he wouldn't find anything of any significance and that this would all just be a diagnostic exam and I would just be better after this. So amazingly, because it was after hours, the team that I had worked with 20 years earlier had heard that I was in the hospital, and they came upstairs to transport, which is not their job. First responders are amazing people. People that work in the hospital are amazing people. They want you to feel like family. They want you to feel happy. They want you to feel comfortable. And they did that. They brought me down to the cardiac cath, and over the years, things have gotten better in cardiac catheterization as far as how invasive the procedure needs to be. And so it was relatively non-invasive. We had a small stick in my radial artery in my right arm, and Dr. Taheri performed the procedure. And of course, knowing what I was getting ready to see, I had asked one of the techs to please not sedate me so that I could focus on the films and I could watch what was happening on the screen. And as I was watching and he was shooting the dye, I saw my arteries light up. And there was a morbid sense of curiosity as to what mine looked like, because I had seen so many other people's in life, but I didn't know what my heart looked like. And I was very happy that my heart looked really good at that point. So it wasn't an artery problem. And then he went to do the LV gram, which is where he sticks a catheter inside the main pumping chamber. And when he did that, I looked over at him and I said, when are you going to step on the pedal? And this kind of dates me as to how long I had been out of the cath lab. And he says, no, this is all live right now. And I said, well, nothing's moving. And that's when he looked at me and he said, well, that's your problem. So I knew something was wrong, and my whole body just kind of went into, my own phase of shock and awe, because I didn't understand why my ventricle was not pumping.
Dr. Taheri, so here you have a friend and a patient with no family history of heart disease, no pre-existing conditions, yet she has a symptom of congestive heart failure. Help us understand this. And how is this caused by stress?
So our initial thought was that she's presented with suggestions of heart failure, but her troponin level is elevated, suggesting that there is myocardial injury. And she's also having signs of edema, weight gain. All of this together, even though we suspect that this is a process of myocardial injury, but the only way to know that this is not due to a blocked artery or a heart attack, or sometimes there are some rare causes of damage to the blood vessels, like a dissection or some other things that can happen to a younger folks without cardiac risk factors, was to be answered in the cath lab. I remember I was going to do this myself, and even before I got to the hospital, I got several phone calls from the cath lab staff calling me, is that Tina Fox that we know from, because they saw her name on the schedule the next day, and so they were calling me to find out, is it Tina Fox? And when I told them it is, I think they wanted to give her the VIP treatment that she deserved in that hospital. So as Tina mentioned, we shot the coronaries in the cath lab, and her arteries were very good and clean. There was no blockages, but her main pumping chamber of the heart, the left ventricle, was barely moving. So that kind of confirmed our diagnosis that this is a myocarditis, which is inflammation and heart muscle disease, as opposed to any kind of heart attack or blocked arteries. But the problem was that even though the good news is she didn't have any blocked arteries, but the bad news is her heart is not pumping and she's in congestive heart failure, okay? But then after we started the treatment for her and got more history from her, and so the diagnosis of Takotsubo cardiomyopathy was made. So this is a diagnosis that I will share more data with you, but it involves getting a lot of history and doing some investigation, and majority of these folks have a trigger for this, Takotsubo cardiomyopathy. So there are several names for this: broken heart syndrome, stress cardiomyopathy, or left ventricular apical ballooning. This was first described in 1990 by a Japanese doctor, Dr. Sato. And there are symptoms that are very similar to somebody who's having a heart attack. So, and those include having severe chest pains, shortness of breath, pulmonary edema or fluid in the lungs, and congestive heart failure. So Tina's symptoms was mainly shortness of breath, pulmonary edema, and congestions. And majority of the patients who suffer from this, they have a major emotional event, whether it would be a life-changing experience, losing a loved one, having a divorce or relationship or something major. And most of the time when you talk to these folks, they would basically pinpoint, say, yes, there was something that was really bothering me. Or in some cases, this would be a chronic stress to the point that there is these sudden surge of stress hormones or catecholamines causing this condition. But the end result of this is the left ventricle, which is the main pumping chamber of the heart, that becomes weak. And interestingly, in most of these folks, there is a segmental wall motion abnormality. There is certain portion of the heart that doesn't move like the rest of the heart. That's why they call this apical ballooning. So if you can look at this diagram, on the left side, it shows a normal heart diagram. And the chamber that is outlined or filled with the red color there, that's the left ventricle. And this ventricle is the main chamber that is pumping the heart to the rest of the body. And when you hear somebody is having congestive heart failure, majority of the time it's because this ventricle is not pumping and there is dysfunction of the pump. On the right side, it shows an example of a Takotsubo cardiomyopathy where the left ventricle is not pumping, and the apex of this is actually ballooned out. And hence the name that they gave it in the Japanese doctor was Takotsubo, meaning Japanese octopus pot. So this is how they, hunt octopus in Japan. And that's how the name started, Takotsubo cardiomyopathy. Now, there is an international Takotsubo registry, and this is considered a rare condition, but I can tell you that at least once every month, we have a patient who has this diagnosis to different degree. Majority of these folks, according to the Takasubu registry, they are female by 90% prevalence. And majority of them, which didn't include Tina, they are postmenopausal and mean age was 66, okay? And again, majority of them are able to name a trigger for this. 40% named an emotional trigger, or 35% physical stress or trigger for this, or both. And in 20% of these folks, there was no trigger, but they still had the same condition or diagnosis. So as far as how do we go about diagnosing these patients, it's very tricky because the EKG shows EKG changes that are also similar to patients who may have a blocked artery or suffering a heart attack, minor heart attack. The blood work shows that the cardiac enzymes, those are the troponin level that are usually a marker for heart muscle injury, goes up. So it actually acts as if this patient is having a heart attack. And then there's an ultrasound or echocardiogram, which is the ultrasound to look at the heart function, shows heart muscle dysfunction or weakness. So all of those can also be found in a patient who may be having a blocked artery. So the only way to know and distinguish this, other than the history and some of the subtle differences, is to do a heart catheterization to know for sure, because you don't want to guess that this is Takasubu cardiomyopathy and you miss on a blocked artery that could have been fixed. So that's why we also recommended doing an angiogram or cardiac catheterization for Tina. And in this test usually shows that the arteries are actually not obstructed. But the last picture that we take is the heart pumping chamber, the LV-gram, and that's when it shows the wall motion abnormality. And just to show you a still frame for this, so that's the heart during relaxation, and the heart on the right side is during a contraction. And you can see the heart is really not contracting other than the base of the heart, which is here. But the whole apex anterior wall, you can see it's kind of balloon, kind of like that octopus pot. So when you're looking at the patient demographics, so this is how we can kind of distinguish this from somebody who may be having a heart attack. So majority are female. That's not a distinguishing factor, but also they are mostly postmenopausal, older female patients. But then again, it can happen to younger patients, as you saw in Tina's case. And majority don't have any prior heart disease and no risk factor for having heart disease. They don't necessarily have high cholesterol, diabetes, hypertension, or smoking history or family history, which is kind of I think this is where we actually start differentiating between those patients. But again, the workup is pretty much the same. But as far as the treatment, the treatment for this is basically medical therapy. They don't usually require any interventions. They don't need anything in the cath lab. And most of this is using the right medications to try to improve their heart condition. So this includes a class of medications called beta blockers. They reduce the stress on the heart, they reduce the heart rate and the blood pressure. Then we have a class of medications called ACE inhibitors or angiotensin receptor blockades. They are also considered blood pressure medications, but they reduce the stress on the heart by lowering the blood pressure. And that makes the pumping easier for the heart. And then we have the class of diuretics. These are agents that increase your urine output and getting rid of the extra congestions and fluid buildup. But most importantly, you have to address the underlying cause. And if this was a stress, whether it was emotional or physical, trying to get rid of those stress. And finally, we usually recommend cardiac rehabilitation, exercise, and some lifestyle modifications that would help the patients get over this. But the good news is majority of these patients recover between 1 to 4 months. Now, what was unique about Tina's situation was that she had an extreme form of this. Not only her heart was pumping at 20%, but her heart rate was really fast. Her baseline heart rate was over 100. And usually that's a bad sign that it shows that the heart is really under stress. And on the other side, her blood pressure was on the low side. So we didn't have a lot of room to be able to use medications that we normally use for this. But we had to be very gentle and try to tweak this. And that's how we treated her. What was different about Tina's case was that her heart was under so much stress, was pumping at 20%. Her heart rate was elevated. Her baseline heart rate was over 100. Her blood pressure was low, limiting us of how much medications we can use for her. Okay. Even though I was hoping for the best, but I also had to prepare her for the worst. I remember sitting in front of her and trying to explain to her that we need to protect her against arrhythmias, and if this doesn't get better, what is our backup plan? But she was a very good patient. She followed all our recommendations. We had close follow-up, and she has done probably 2 or 3 echoes by now, and every time we did a follow-up, she was feeling better and better, and her heart got better and better, to the point that after about 4 months, she has been off of all her medications, and she can probably tell us about how she feels now.
Yeah, so it was a mixed bag of feelings. I mean, when you sat there and you told me succinctly, what we were dealing with, what we might have to deal with in the future. I remember you even bringing in the advanced heart failure team and the talk of potential transplantation. I won't lie to you, that sort of freaked me out a little bit, but you were very matter of fact about it. You were very good with telling me what was going on, and there was a sense of calm, because I really felt like, okay, at least we know what's happening and you have a plan. And I remember when you said, I had already checked myself out of the hospital after the cardiac catheterization, but then you saw me in the office and you suggested that I check back in as a voluntary inpatient, which I was not happy with at all. However, the reason being, as you mentioned, is I had the confluence of all these things that were not right, like low blood pressure, along with a low EF. And that was very difficult to manage medically outside of a hospital setting. So when I had to go back in, I wasn't happy, but I knew why. And the care that I received was outstanding. I was nervous that my condition was stress related. And I really didn't understand what the significant event was for me personally. But that I knew that because it was stress related, I could maybe throw myself back into this. And so there's always that fear that remains with me that this could happen again if I'm not careful and if I don't treat myself wholly. But having you as, the friend and cardiologist that you are really got me through all of this. And I was going to be the best cardiac student. And I think that's what got me through this initial phase. So I thank you very much.
Knowing Tina as I do, and when she reached out to me during this time, I couldn't help but notice the irony that Tina put the same type of focus and energy into her recovery as she did that maybe led her down the path to have the stress in the first place. So she was able to harness it in a positive way, which is just the Tina that we know and love. Tina, how are you feeling now?
I feel amazingly well. I mean, I remember how I felt when this happened. Like I said, it was no flu I had ever had. It was the worst thing ever. And slowly but surely, it was little steps, right? I could barely walk from my bedroom to the bathroom. And then it was, once I got past that, it was okay. Now I can walk up a flight of stairs in my house. And then it was, I can walk down the block. And between the medication and the diet change and just the cardiac rehab and the follow-up visits, it was all micro steps leading to the goal of health. And I was shocked that this happened in late September. And by January 11th, Dr. Taheri was giving me the all clear to move forward in life.
So as you look back on this and maybe even look forward and have suggestions for other people that may have stresses in their life, what have you learned from this? And what are maybe some suggestions you'd have for people from what you went through and what they can do differently?
Well, I've learned that stress is no joke and that it's not something that can be diagnosed, unfortunately. There's no test. There's no test for stress. And we all experience it. We experience it at different levels and at different times and in different ways. And I've learned that, the body and the mind and the spirit are all one thing. If you do not take care of yourself completely, any one that goes off, and in this case, it was really my mental health, right? My stress levels had built up to a point where I had not really recognized it, nor had I dealt with it. And I think so many of us put others first. And Dr. Taheri mentioned how this affects mostly women. And I think that women in particular, we put our families first, we put our kids first, for those of us that are business owners, we put our employees first, customers first. We do a lot of things to put others first. And unfortunately, our health suffers in that. And so I've made my total health a priority. And I implore that people that are watching this do the same, because it's not about doing massive switches. I talked about how, it was just as simple as from walking from my bedroom to the bathroom and then gearing that up day after day. It's really the consistency of moving forward with those mini goals, small habits, one at a time, and recognize where you're having trouble and seek that help. Don't wait to go to your doctor like I did. I waited over 2 days before I went to go see my physician, to the point where I could no longer walk. And that was a big mistake on my part, big mistake. But I would say that, whatever helps you de-stress, I'm sort of with Nike, you just do it, right? So I'm hoping everybody just goes out there and takes good care of themselves.
Dr. Taheri, from your perspective, what do you want the community to know that they can do and be mindful of, considering Tina's experience?
So there is another condition called prinzmetal angina, very similar patient population. And they are predominantly female, stress, and no cardiac risk factors. So the difference is what Takasubu is and what Tina experienced is an extreme case where the heart is failing and not pumping. So the other part of this, which is very similar, and we see that for every Takasubu patients I see probably 10 patients who have prinzmetal angina. So I think my also comment for the rest of the folks who may have that is they experience chest pain and tightness, which is very similar to an angina attack. But when you're looking at them, they don't have any risk factors, they don't have any reasons to have blocked arteries, and their description of this is so similar to angina. And sometimes when you hear the story and you kind of put this together, I feel like you don't even need to do a stress test to rule out a coronary disease, but a lot of times they respond to nitroglycerin, because what happens in these folks is that they have a spasm of the arteries and they get same chest pain as if their arteries is blocked. And it's very annoying, it's tightness, and a lot of times by stress reduction, by using minimal pharmacological therapy, they respond pretty quickly to this. But I think most of this is, putting their mind at ease that, this is not a heart attack, this has a cure, that you start to feel better. But to answer your question, I think my message is that people don't realize that the stress can have physical consequences. And as Tina mentioned, keeping it inside is not the healthy way to do this. And a lot of times, especially with the current environment, going through this pandemic, everybody's life has changed. And nobody was prepared for this. Everybody's under a lot of stress. I can tell you this, that pretty much out of every 10 new patients I see, a couple of them are stress related, whether it's prinzmetal angina or their blood pressure or anxiety attacks. And we really have to help each other and have to watch out for your loved ones that may be experiencing this, to try to be mindful of this and help them get through this. And stress doesn't affect people the same way. So even in the same household, people are dealing differently with the stress. So we have to be mindful and watching around you and see who may need some help getting through this.
Thank you both for sharing your story. Thank you for taking such great care of Tina. Your recovery has been remarkable. For those of you who are watching this and listening to this, please do listen to your body. Please take care of yourself and your loved ones, and be well. Thank you so much.